everyone, it's me, Dr. Sarah Sadek. Welcome back to Smart Braces and Invisalign, a channel all about teeth and braces. In today's video, I'm going to be covering everything you need to know about vaping. I'll be covering statistics on the current prevalence of vaping, also known as e-cigarettes, why people use them, if e-cigarettes are contributing to a decline in smoking. I'll be letting you know if there are any regulations on e-cigarettes. And crucially, I'll be discussing 3 chemicals in e-cigarettes and their effects on oral health. I'll also be talking about vaping and its effects on braces and Invisalign, so do make sure you stay tuned right until the end. This will be a really interesting video, so keep watching. So vaping works by heating a liquid to generate an aerosol that the user inhales. The liquid in the e-cigarette is known as an e-liquid, and it's usually made up of a few components. These are propylene glycol, glycerine, nicotine, water, and flavorings. Now, in practice, e-cigarette users tend to reach a lower blood nicotine level than tobacco smokers, although it's difficult to make a direct comparison because nicotine concentrations in e-cigarettes can vary quite widely. So what are the reasons that people vape? Firstly, some people vape because they want to help with smoking cessation. Others vape because they think it's less harmful than smoking tobacco cigarettes. Some people vape to avoid smoke-free areas. Lastly, some people vape purely for recreational enjoyment. Let's discuss the prevalence of vaping. The most recent large survey by the CDC in America, which is a national health survey in 2018, found that 14.9% of adults had tried vaping, and 3.9% of adults were regular users of e-cigarettes. The prevalence was highest amongst adults in the 18 to 24 age group, and in 2018 it was estimated that 8.1 million US adults were currently using e-cigarettes. If we have a look at the UK, a study by Smoke Free GB, which they do annually, found that e-cigarette use amongst adults in their most recent study in 2021 had increased to 7.1%, amounting to 3.6 million people. The study by Smoke Free GB found that 36% of the population said that the reason they vape because they wanted to use it to help them to quit smoking. Another 20% said they used it to stop them going back to smoking, and 26% said they used it to cut down on smoking. What's quite interesting is that in 2012, only 49% of the population had heard of e-cigarettes, compared to 2021, where 93% of the population have heard of e-cigarettes. Are e-cigarettes contributing to a decline in smoking, you may be asking? Well, interestingly, in 2011, 19.8% of UK adults smoked. This fell to 13.9% in 2019. That's equivalent to a drop of about 2 million smokers. But what happened during this time, which is what's been associated with the main reductions of smoking? These include a tobacco display ban, a move to plain packaging on packets, increased tobacco taxes, and minimum pack sizes. Now, these are all likely to have helped contribute to the reduction in the number of people smoking. Now, there are regulations governing e-cigarettes. You have to be a minimum of 18 years old to legally buy e-cigarettes, and it's illegal to sell e-cigarettes containing nicotine to anyone under 18. From 2016, advertising or promoting, directly or indirectly, e-cigarettes on a number of media platforms, including television, radio, newspapers, and magazines, was prohibited. The only advertising that's still allowed is advertising at the point of sale or on billboards. There is also a limit to the amount of nicotine that's allowed to be placed in e-cigarettes, with the maximum dose being 20 milligrams per mil, and anything above that is not allowed to be sold. So far, so good. So are there any concerns associated with e-cigarettes? Researchers and anti-tobacco advocates are particularly concerned that irresponsible marketing has made e-cigarettes appeal to the younger age category that had no history of smoking tobacco and never intended to start smoking in the first place. And the use of e-cigarettes amongst high school children from 2017 to 2018 increased by 78%. Stay tuned for part 2, where I'll be discussing the components of e-cigarettes and their effects on your mouth, teeth, and braces.